Hello and welcome back to the Healthcare Uncomplicated YouTube channel. Today I have another fantastic topic and guest for you. But before I go ahead, let me remind you to subscribe to the channel and also share all the previous content there with your communities and with your peers in healthcare. It's all about healthcare technology, bespoke content with the global experts every week for you. And today gives me great pleasure to introduce you to Muhammad Siddiqui. He's the Chief Information Officer at ReidHealth. Muhammad, how are you?
Good morning, Jules. Good morning. I'm very well. How are you, sir? It's been a
Um,
long time.
it's been a long time. And nice to see you again. You know, it was a while when we connected in person in US. We're talking about that before the recording, right?
Absolutely. I think we met last time in Hampton, Chicago. What an amazing event. It was great to see you there.
It was brilliant. Yeah, it's good to have all the global events back after the pandemic. It was a bit of a roller coaster, but now everybody is back in full steam, if you like. And today we are here to discuss a very interesting topic: patient experience, from the patient to consumer experience. And the first question that I have for you, Mohammed, is can you define patient experience in this context in healthcare?
Yeah, sure. So the patient experience in healthcare is the range of interactions the patient have with the healthcare system, whether with a care provider, wherever they are working and communicating with your nursing, staff in a hospital, healthcare facility. What is their experience look like, right? I mean, always a difference between the service and there's a difference between the experience, right? Service is, hey, listen, I wanted to go ahead and paint my house. Somebody come and paint the house and they leave. That's a service. Experience means how do I feel after the paint? That's exactly how we have to do in a healthy environment.
Fantastic. Moving on, what's the role of technology in shaping the consumer experience?
Yeah, I think it is an excellent question. I think I firmly believe that technology is playing in a great role in enhancing the experience for the patient. Imagine that the word patient is coming from Latin word means somebody is suffering, right? That's what the definition is. So improving the experience, leveraging a technology, reduce that suffering for me. This is the best cost and any professional person can do. And that's where the technology is doing there as well. I think there's a three things are there for technology. Our patients wants to know, you know me, who I am, what my concerns are, go beyond my clinical records, understand my unique background as a patient, preference, and why I'm here today. Connect with me, right? That's another thing. Engage with me the way that with very relevant to me or meaningful for me, right? Utilize the communication based on how I wanted to communicate. Do I really want an email or do I want an SMS or do I need to pick up the phone? We need to gather that information and build the trust and rapport through that connection that you build with me. And then third one would be orchestrate the care for me, right? Use AI, use machine learning, use predictive modeling to proactive monitor my care. So those three things, know me, connect with me, orchestrate with me. Those are a three components. That's where technology is playing a big role.
Brilliant. I really like that analogy, Mohammed, because also what you share is a true personalized experience because everybody is different. So, and get to know people beforehand. You know, one of the problems that I see with technology is, and it's very difficult to change that, is we gather for the masses and we have a platform that does the same thing for everybody. So it's very difficult if you have thousands of patients to do a personalized intervention for each patient, of course. But what you mentioned is really important. Know them, know what they need, and then gather for them. So thank you for sharing that. Moving on.
And I wanna add one more thing. I think we often forget we need to streamline the care journey, right? I mean, that's where the technology comes in. We need to understand how can I remove the friction point from the patient's life. Patient is already suffering. Nobody have fun or Joy to come and see a doctor, right? Or come to the hospital, right? They are here because they're not feeling well, they are ill, their life is disturbed for whatever illness they have at that time. We need to make sure that we make a warm welcome for those patients that come into the hospital. I'll give you an example. Today in a US healthcare system, nothing but the waiting, waiting, and waiting, right? First, you pick up the phone, you call and book an appointment. Average wait time for a primary care provider is over 20 plus days. You have to wait to see a primary care doctor. If you are sick today, imagine that. If you have a minor viral infection that generally go away 3 or 4 days, you really want to wait 12 or 15 days to see a doctor. Doesn't make any sense. Forget that. You book an appointment, you drive your car into the parking. Now you are looking for the parking. Hey, where is the parking is? That's a challenge. Forget about that. If you bring someone need a wheelchair, what do? You park the car up front of the hospital main entrance, you go inside, grab the wheelchair, bring the patient in. Is that logical? You walk into the hospital, you don't know your way around it. Then you go in a waiting room, and waiting room, you wait, you don't know what's happening there. So for me, just like you sitting at the airport, you're ready to be departure, and you don't know what time the departure time is for the flight. You're just waiting and waiting and waiting. So I think these are things we all have to look at it and see how technology can solve all these issues.
Brilliant. Thank you for painting that picture, which is a true journey, which is the reality check. And of course, the healthcare systems around the world are not ideal. I mean, what you mentioned is very powerful. Having an infection, you can't wait for 20 days or a week because you're going to get more ill or even the infection is going to go. So, yeah. Moving on, patient centered care versus consumer centric approach. What are the challenges and benefits of adopting a consumer centric approach?
Yeah, I think when I talk about healthcare, right? I mean, healthcare is running behind time when it comes to a consumer experience. However, thanks to Amazon, they really spoil our today's patient. They really expect a service like on their fingertip. I mean, if you look at it, the iPhone was invented. What year was it? Like 2009. What we can do in with our smartphone today versus 20 years ago is completely changed, right? I mean, the change is coming so fast. I think adopting the consumer centric approach or person centric approach or the human centric approach is you really putting the patient in middle, the center of the care, right? We should not be deploying a solution without getting a feedback from the patient. Just like I'm cooking a meal in a kitchen, which I'm going to eat, you're not asking me, how do you want my steak to be cooked, right? How spicy I want this. Really? Do you want me to add any zest to the steak? So I think these kind of things is very critical to build a person-centered care environment in a healthcare today.
Brilliant. Mohammed, thank you so much. We can talk for a long time. It's such an interesting topic with the different
It is.
challenges, nuances, and of course angles. And there's a lot that we can do. And I like that personalization, thinking about every single detail, but most importantly, what is important to that particular patient, that particular person, what is going to enhance the experience, and of course, the overall outcome of the condition or whatever they're treating at that particular moment. Um, I have one last item that I want to ask you related to the channel, which is like a big question. I'm always looking for a short answer, which is how can we make healthcare uncomplicated?
Or you mean the less complicated or the more
Yeah.
complicated?
Uncomplicated, less complicated.
I think Jose, I think you and I both agree on this, and we talked about it before. Our health system is overcomplicated. I think we can make it less complicated where we can have create more access and accessibility channels for our patient to be get access and create an accessibility should not be an issue. I think we need to improve the communication with our patient and transparency there. We need to add a lot more personalization when it comes to the patient. Remember, patient needs to know, you should know the patient when they call you, right? Rather than you asking the question to the patient. We really need to see how can we streamline the processes. I mean the debt of the clipboard. Remember the old days when we have a clipboard, we still have a same process. You have to go make the co-payment for this window. Now you go ahead and get your labs done on this window. Why we cannot make a persona for patients seamless experience, like one-stop shop for everything, where people know. So I'll give you an example. What we have done at ReidHealth, obviously we are a big epic shop. Patient can check in a couple days before their appointment when they walked in. When they park the car to get into our outpatient clinic, they can do check-in. Hey, listen, based on a geolocation, hey, listen, I'm here today. By the time they come and wait in a waiting room, we know the patient is here. So patient doesn't have to go pay the copay, number one, because we collect the copay while we're doing the check-in, right? So we know the patient is here. That kind of system we really need to build at every single touch point that patients engage with the healthcare today. And I think that will make a patient's life very easy in my view.
Brilliant. Thank you so much, Mohammed. Really nice to see you. Thank you so
Thank you.
much for this amazing input, your expertise, and your contribution, of course, for the industry. Thank you so much for this amazing interview.
Oh, thanks for having me. Thank you.
Brilliant. To all our viewers and listeners, make sure you subscribe to the channel. But also, I'm going to post Mohammed's socials in here, his LinkedIn. Make sure you get in touch with him for any industry interaction. And I look forward to seeing you all next time.